Hi everyone! Here we are. This is the end of an intensive week. This was quite amazing. This was a unique project that we really wanted to achieve. It was super to get through all this week and all these intensive days of knowledge sharing. I'm very happy to have reached more than 12,000 participants from more than 120 countries. But also, I would like to say, going to my presentation, please. Okay. I would like to say that it always seems impossible until it's done. In fact, this project was thought some years ago. In 2015 we did the first edition, and we wanted to do it again and try to achieve better, and try also to deliver a fantastic experience as it was in 2015. We have this mission. We think that knowledge should be shared and without boundaries. As you know, this is something that I'm really linked to it, me and Rui and all the team. I think we step by step we have been changing the paradigm of dental education, because from the message that we received from all over the world, I think this quote is quite true. Nelson Mandela said this some years ago. Of course, Nelson Mandela remembers me, some of my friends in South Africa that I had the chance to visit this year. I would like to say hi to Mike Bowes, and would like to say hi also to Howie Gluckman and Helen Bowes. So now I would love to have. I'm sorry, but we have here slight problem. So let's talk a little bit about it. This wasn't flawless, and as it wasn't flawless, I'm here also to assume those problems. So we tried to manage the best we could. We are very sorry if we disappointed you somehow, but I profit from this occasion to give my best regards as well to Dr. Nitsan Bishasho. Just before me, we had a technical issue with the platform, so I'm very sorry for that. But I profit also from this occasion to thank the speakers, every one of the speakers, big number of speakers from more than 27 countries, and so I would like to thank you, all of them, because they are truly masters. They resonate with our mission. They are friends. We've become friends, and I'm sure that if we can be together in some place, somewhere, I'm sure that we'll share wonderful moments. So this is something that I would like to point out. All the speakers from all the continents, many that have brought a super intensive week, full of knowledge, but it is you, the participant, that makes this project exist. So as you see from this world map, the little dots are all the cities that where we can find participants. So as you can see, a lot of countries, from Middle East to Europe to Asia to North America, Central America, South America, Africa, and Australia, New Zealand, everywhere. So this is something that for us was an idea, a dream, and you have made it an accomplishment, a success. So the first thing we would like to know and we would like to ask you is, please profit from the comment bar below and write or an emoji of your country flag, or let me hear from you. Let me hear from where you're watching. Okay, so also today we have some special features. We would like to deliver the prices for the challenge. We had more than 1,500 participants in the challenge throughout the week, following all the lectures and participating. So thank you so much. That was really fun. Also today the challenge of the selfies was great as well. We will talk about that later. So the first thing that we would like to ask you is, for the selfie contest with the hashtag AestheticMasters2017 rocks, we have chosen the 3 best photographs, and we would like to have your vote. So the best picture that you vote will be the one that wins. So who is now putting here the photographs? So you just have to click on Menti, www.menti.com, and click on the number or send a message 34525, and the best photo will win. Okay, so let's hear from you. Let's hear your votes. Let's have your votes. Let's have fun. We are really thrilled and really excited for we have on the left side photo 1 from Romania. We have the second one is also from Romania, and the third one is from Portugal. So those were the top 3. One in the clinic, another one just outside, and the Portuguese friend was in, I would say, if you allow me, Peter, in the middle of nowhere. So let me hear from you. Let me check the votings. I would like to thank you, Radu Vataman from Romania. I would like also to thank you, Paula Olario from Romania. And finishing, I'd like to thank Peter Perez from Portugal for following all this week. And as you see, the voting is, the polling is just rising as you have the votings coming. So we are just waiting for another minute, and then we'll stop and we'll have the final count, and the prize will be a premium membership for the best photo. So this is also to congratulate every one of the participants for their patience, for being with us, for being extraordinary colleagues, and for sure we will meet again. And one of the things that me and Rui would like to say is, if anywhere or somewhere you meet us or you come across us, please say hi, and we just would love to know you personally, and that will be super. Now we have a tie between photo 2 and photo 3, and you can use a smartphone. Now Peter is going a little bit further. I'm waiting just like 15 seconds. I'm very sorry for this short late, but there's a delay from what I say and from what you see and you hear. So let me just wait like 30 seconds more, and we will be soon with the final counting of this special challenge. Okay. Also I would like to say that despite our efforts and the speaker's efforts, we would like also to apologize for Dr. Enrique Diaz and for Dr. Marcelo Calamita. We hope we find a solution that will match your expectation as well. So we will finish now the counting and we continue with the presentation. And the winner is Peter Perez. He wins a premium membership. Okay, let's get back to the presentation now. And congratulations to Peter. And let me get back here to the presentation. And here is a little bit of myself. As you know, I'm João Borges. I have a private practice in Lisbon, but I'm also linked to the WIC University in Barcelona. And I'm here to talk about what, for me, are the 5 keys to achieve long-term success in your ceramic veneer treatment. Okay? First of all, let me just say to you that this is where I practice. This is my clinic. Of course, it's a special session. I don't have like 12 hours work with such a setup. But anyway, that's one of my assistants, Rita. And this is my personal dental office. Okay. And this is where I give classes. This means a lot to me. The WIC University in Barcelona, thanks to Dr. Luis Jané and Dr. Miguel Jorge, because they are our mentors, mine and Rui Pereira da Costa. And these are my students, my dear, dear students. On the top photo on your right, you have some have finished already the post-graduation in restorative aesthetic dentistry. And the photo on the bottom right on your screen are the ones from this year, okay? And so we start with the presentation itself. The treatment steps, you have, like, I would say, like 4 treatment steps. You have diagnosis, you have planning, you have the treatment, I would say the more technical parts of the treatment, and then the maintenance. When I say 5 keys for your success, it means that among these 4 steps, 4 general steps, you will find the keys for your success. And the first one I would say is the diagnosis. Okay, one of the diagnoses, what I would like to tell you is, if you have a case like this one, it's quite curious because along this lecture I will just jump through the lectures of my fellow speakers during this International Aesthetic Masters. And this has been my protocol, my photographic protocol, that is like a dynamic setup of photos where you can see the relation between the upper lip, the lower lip, and the movement along the way. Of course, you can do this with a video. You can manage better sometimes the choice of photographs, but you can also do using your smartphone. The most important thing is to check that on the left of your screen you have the rest position, and by the rest position you have the general facial relationship regarding the teeth, and that is one of the most important images because you will see there the teeth exposure, the upper incisors teeth exposure, that in fact will guide you through the rest of your treatment. Then you go through the dynamic phase of this photographic setup, and on your right you'll have then a more focused attention on the relationship between the teeth and the tissues just around, I would say, the upper lip, the lower lip, and the gingiva, of course, the relationship with the buccal corridors. Okay, so as you see there, you have, in this case, you have short incisors, upper incisors, and this patient came with a complaint about the length of her upper teeth, and with the will to treat these teeth with veneers, because of course these young patients are well informed. So the first thing I would like to ask you in another, I would say, challenge is, if, as you see here, you have altogether the structure that is lost. Of course, you have also the tip of the canines that has been weared out. So the first thing I would like to ask you is, would you immediately do veneers in this case? Would you treat this case with veneers? Yes, no, what would be your choice? Or, in fact, my question is, for you, as a minimally invasive dentist, someone that I hope after this week is someone linked to the preservation of structures, the enamel, the dentin, most of the tooth structure. My question is, would you treat this case immediately with veneers? Would you have something in mind? Would you have something to consider? Yes or no? So this is my first question, knowing that for that you should go to www.menti.com and use the code 182657 to vote using your smartphone. Okay, of course this is free. Okay, it's curious that you say you don't treat with veneers, because maybe you will some of you say no, some of you say yes. So it's quite interesting that in this case you are more into the no than into the yes. As you see, it goes through with that. Following this presentation as well might be Dr. Francesca Vailati, that has developed a lot with this in this subject regarding the palatal veneers and the rehabilitation with buccal veneers, ceramic veneers as well. So I'm just waiting a little bit, just 30 seconds more, just to. These quiz and challenges are great because it makes you want to participate, but it's also, with the delay, it's quite confusing, I must say. But anyway, in this case, most of you would say no. So let me get back to the presentation and to the keys to the success of the veneer treatment. Rui, can we get back to the presentation? Thank you so much. And here for the switching of the slide, please. Okay. So the first key to achieve the long-term success in your ceramic veneer is functional diagnosis. Okay? When I asked the question is, I wanted you to think that using that image, of course, I cannot tell. I cannot tell if I would rehabilitate with veneers or not. Normally I wouldn't, because those 40s are not capable of having an overload, as we saw in that picture, with a loss of vertical dimension, etc. So in this case, when I mean functional diagnosis, I mean you have to take a look at the TMJ, the right and the left, check if there's any pathology, any pain, any normal situation. Also check if you have trigger points, if you have any problem with the muscles, and as well, of course, check the dental occlusion. And the dental occlusion, you need to check not only the premature contact as the interference contact. It means that when you check the dental occlusion, you need to check on the opening and the closing of the mouth, checking if there's a premature contact that would change a little bit the relationship between both arch. It means that the premature contact can change the central relation position, so it can go outside what I would say is a physiological position of to rehabilitate. That's the most important thing, because if you rehabilitate outside of the physiological position, you are getting into trouble, I would say, because you are into an unstable situation that can have as a consequence afterwards some problem for your final rehabilitation. Okay, let me go further. As you see, when I do the functional diagnosis of this special case, in the protrusive movement, I can see that there's an interference. There's no incisive guidance, so there's no functional protection. There's no dynamic protection regarding this special clinical case. So as you see, we have an interference on this movement with a contact between the first upper premolar and the lower second premolar. When I go to the lateral movements, so protrusive and lateral movements need to be evaluated and checked for interference on the side of the movement and the contralateral area of the movement, because all this interference that might happen can cause an unstable situation and can lead to a parafunction or excess parafunction. Okay, so can I have also my camera on, please? Because I would love people to see me. Hi there again. So if I go through here my slides again, this is the lateral movement for the right and the lateral movement for the left side, as well with the interference. So what we have understood in this case is we cannot start a case like this one without this functional evaluation. Because imagine that you would decide to do minimal invasive treatment over these 4 upper incisors with veneers, and you wouldn't have thought about this. Of course, after this week, you are more informed and knowledge have been shared, so I'm sure that you are more attentive to that. But this means that sometimes a very specific problem is in fact a functional problem. So we need to treat and rehabilitate the entire mouth and not only for teeth. As Dr. Francesca Vallati told, and Dr. Mauro Fradiani and many others throughout this week in the oral rehabilitation subject, half smiles and 1 or 2 teeth is not exactly what can lead to long-term success. Okay, so another case, I will present 3 cases, and throughout the 3 cases I will talk about all the key factors for the success. This is a second case in which we have a functional diagnosis. This patient also came because she wanted 6 veneers on the in between canine to canine. Okay, and so here, as you can see, you have our functional diagnosis, intraoral functional diagnosis, in which you can see that there's a lack of canine guidance and also some interference on the posterior regions. Okay, so the protrusive movement is also quite special because it's blocked. It had an interference on the posterior region. Normally it comes on the most posterior teeth that can be badly positioned, and in this case it was the second premolar, so the second molar, sorry. So one of the goals of this treatment is promote better desocclusion in the eccentric movements, because better desocclusion on the eccentric movements can lead to better and better stability, and so better result in the final end. Okay, the third case is a more complex case because it's a case not only with interference, but in which we have evaluated using, in fact, using a TENS transcutaneous muscular simulation that in fact is what enables you to annulate more or less the muscle activity and get exactly the most physiological position possible. And in this case, we had a prematurity on the closing of the mouth, with in between the second lower molar, right molar, with the second upper right molar. Okay, so in this case, as you see, the same protocol: first functional diagnosis, and as you see here, in this case we also had a lot of wear, and the wear is typical for cases like this one, in which we have a prematurity on the posterior regions that goes and has a consequence as an advancement of the mandible, getting rid of that contact, the prematurity. So you have much more wear of the anterior teeth than you have on your posterior teeth. So this is the first point. The first key is functional diagnosis, will be diagnosis. So I would like throughout this lecture to have also your feedback. I would love to hear from you and have the best lecture of day one voted from by all the participants. I would like to know who was the best speaker of day one. We started with Stefan Broé, then we had Joana Garcês from Portugal, then Stefan Kubi from France, we had Joan Figueira from Venezuela, Maciej Zarau from Poland, Howie Gluckman from South Africa, and Francesca Valati finishing the day from Italy. I also had a lecture in that day, but that doesn't count because we really wanted to have your votings for the international renowned speakers and not ourselves. Okay. Of course, when it comes to Rui, you can vote for him. He was saying that, oh, my name is in the middle. So at that moment, of course, you can. So we are getting more and more participants in this lecture, and we are just waiting for the final poll and the final counting to come. We have all the team here. We have had some funny moments. We have lost the drone in the waters of the Taja River. We have been running from the police because we were not allowed to film with drones, but we managed to do a super intro movie. We have had so many adventures throughout this week. Yesterday, I was like really going crazy and running to come here to Rui and to have Paulo Cano's lecture just in time. We were very lucky for that. We are receiving the votings, and we have here a lot of votings for Dr. Francesca Valati, that everyone has delivered. Everyone has delivered a lot of feedback regarding those lectures. I would say that we will stop the voting now. Francesca Valati won. Grazie Francesca, and thank you so much. And here we go back to my lecture. Okay, so first step is functional diagnosis. Very important before you treat any case whatsoever. The second point is planning and the mock-up. This point is really important also because not only you are validating your project with your laboratory and you validate with the mock-up afterwards, but as well you have the patient acceptance. In aesthetic dentistry, you have something that is really crucial for the success of your treatment, that is the emotional part of the patient to accept himself and the new smile that you provide. Okay, of course, on a daily basis, this doesn't come only with very and big aesthetical changes, but for any treatment whatsoever. Okay, I think that sometimes the patients are not really aware of what we will be doing. So I would say that the second step, the planning and mock-up, is the validation of your diagnosis and the validation of your treatment plan. And in fact, I would say it's like a bussola, your road to the success, because through a good mock-up and through a good starting point and planning, you can in fact have the rest of the treatment going very easily and very straightforward. Okay. Regarding the planning, of course, you can do a DST, you can do a walks-up, you can use whatever you want. I'm not going into those details because those were in fact a lot of things that were thought throughout this week, but I would like to have these cases just shown. So going through, this is the diagnosis and this is the mock-up. Okay, going back, diagnosis and mock-up. One of the things that is also important that I would like to say, please never show the mirror to your patient. Okay, the patient doesn't have the ability to understand through the mirror what he has and the change he has. So try to have the same space and same area to photograph, and then show the photographs between before and after, because he can understand better on a screen than through a mirror, where he or she will search for certain details that a mock-up is not ready to give. Okay, so as you see, you have some aesthetical improvement, but for sure, as this is a functional rehabilitation, you have a rise of vertical dimension and you have a better relation between the teeth and the lower lip. Going through this case before and after, again, you see the difference between the left and the right of your screen. Regarding the other case that we are going through, we have the before and after, and here we can evaluate that the tooth 23 is a little bit too long, and we might have to diminish a little bit and try to have different canine guidance and canine ramp to enable a better disocclusion on the eccentric movements. Okay, so as you see, this is before and after of this second case, and just a movie with the mock-up. We use a silicone key done by the laboratory after the wax-up. Okay, be sure to cut it exactly as you have here, because you also need to try in, and trying in you can check of course the adaptation, and you can check that this silicone index is ready to deliver a good mock-up, meaning that it is done in a way that you have a good adaptation on the cervical area to remove all the excess. Okay, also you can use different approaches. You can also use a skin concept. You can use, as Dr. Paulo Cano talked, you can use many other ways. You can use flowable composite. You have many other options, but anyway, this is one of the options. One of the things that you need to confirm after is the functional evaluation as well, just to check if the rehabilitation has proven to be better in terms of function, as you can see here. Okay, you have a better disocclusion on the lateral movements, and of course you will need then to evaluate and rehabilitate maybe some posterior teeth, but on the additive way, meaning some overlays in composite, just to get good occlusion plane and a good contact on the posterior region. Okay, if we go through the image before and after, you see the before and you see the after, with a better relation with the lower lip and a better relation with the tooth size and the teeth size of the centrals that were too square, and now they are more adapted to the facial contour and to this patient. Of course, this patient is wanted her face to be private, so for that reason I'm not showing as I did in the previous case. So let me get back here to the third case, and as you can see, on a vertical dimension that has to be raised, of course you also need to do a bemaxillary wax-up and a bemaxillary mock-up, and somehow in some cases when the rise of vertical dimension is too high, you need to adhere all the mock-up and get your muscles and your TMJ used to the new situation. Also, Dr. Mauro Fradiani talked about that, and very nice article that we are willing and excited to read closely in short term, written by him. It's a retrospective study with more than 100 patients with the consequences of the rise of vertical dimension. Anyway, in my opinion, and from what I read and from the science, there's no such consequence on the rise of vertical dimension like this one of 4 millimeters. And in this case, we had the mock-up in the mouth for more or less 1 month, 1 month and a half, okay? After and before we performed the treatment. So you see here the wear of the anterior teeth for this case, and also here, as you can see, you have the mock-up in place ready to be used also by us to help us to guide us, in fact, through all the preparation. Okay, so let's vote now the best lecture of day 2. So as I was saying, first we have we'll have the functional evaluation, functional diagnosis. Second key factor will be the planning and the mock-up for the patient acceptance and for a good communication with the laboratory. The mock-up is also very helpful to have you to have as a guide for your preparation. It's also very helpful in cases of vertical dimension that has to be raised for the adaptation of the muscles and the TMJ in cases of rising of vertical dimension. So we have best speaker of day 2, and the votings are coming in. The lecture which gets the more votes will be replayed next week. Okay, the best lecture will be replayed for everyone, and we are receiving the votings. I would also like to thank you again for participating so intensively in all the challenges that we have been developing throughout this week to keep you connected to us and to our project and to our speakers. We have now the votings coming in, okay, and we have Christian Coachman that is winning the poll so far, but we also have German Albertini and Engin Taviloglu in good position. German is just rising now with 7 votings, and Christian is also pushing forward his voting. So this is the best speaker of day 2. We had Carlos Ayala from Peru, Leonard Nelwan from Indonesia, Felipe Lopes and Bernardo Correia from Portugal, Ana Saloum talking us from United Arab Emirates. We also had Engin Taviloglu talking from Turkey, Luis Cuadrado from Spain, German Albertini from Argentina, and Christian Coachman from Brazil. So I would say that the voting has ended because, of course, we have many viewers, but many don't participate. It's okay, no problem whatsoever. So Christian Coachman wins the poll. So let's get back to my presentation. And we get now to the treatment steps, and the treatment steps are the treatment phase, and the treatment phase is one of the good and important moments, a key factor for your success. The third would be the preparation. When you enter the treatment phase, the third would be the preparation, because in fact you not only need to keep and conserve enamel, as you need also to have round edges on your preparations and have all the surface very smooth. As we are more and more into CAD-CAM rehabilitations and monolithic rehabilitations, don't forget that digital scanners and the CAD-CAM machinery with the burrs, they work much better with round edges and with smooth surfaces. Okay, so let's go a little bit through that. We have here, you can see the preparation with round edges of this specific case. In this specific case, we have just a second, please. In this specific case, we had a bimaxillary rehabilitation, a functional rehabilitation, and we have round edges through the round edges in the preparation of these anterior teeth, as you can see. Okay. Also here, regarding this preparation of the lower teeth, you have to keep your preparation. You have to keep your preparation supragingival or juxtagingival. Okay, no need to go infragingival. And finish with the Soflex disc, as you can see here. Soflex disc. This photograph was taken by my dear friend and colleague Katarina Vitrin, that I would like to thank for this photograph while I was prepping. Okay, so this is the rules: round edges, supragingival, juxtagingival preparations. This is the conservative preparations and minimally invasive preparations of the lower jaw of this patient. And in this case, you also have, in the second case, some details of the preparations, in which we didn't lower the incisal edges of the lower teeth, and we kept the preparations, as you see, the limit of the preparation juxtagingival. And for the upper teeth, after the lower teeth and the posterior regions have been rehabilitated following Francesca Svalati three-step technique, as you can see here, you need to respect as well the three components of the preparation, from incisal to cervical area, meaning that you cannot go straight. You need to follow all the convex surface of each tooth and follow each tooth. Don't forget that also the laterals need to have a little bit more preparation on the distal area to allow a better surface for the laboratory to work on, and to give the second distal inclination of your for your veneer. Of course, all of this I will talk in detail throughout the online course that I will give afterwards. Okay, but here you can see with the retraction cords in place before the final impression of the upper teeth, and those ceramic veneers that will be placed over these anterior teeth. You can see the preparation that is really smooth, the round angles, etc, etc, etc. Here we see a movie from the other case, the third case, where you can check on the use of the disc, and after this you just go for the impression. And the final impression is very important because it's a communication with the laboratory. You can use a chemical retraction a material like this one from 3M. You also have Expasil from a French brand. This is really good because you don't have to use retraction cords, and you just need to wash after 2 minutes and a half. Of course, this is only possible when your preparations are juicer gingival or supra gingival, because the most important thing of all is those limits to be seen by laboratory. This is a quite quick movie where I show you the placement of the addition silicone, light body, first material that is placed, then some air spray just to get out the air bubbles close to the cervical limit, and here the impression, the final impression. So here you can see the before and after of this case, of this third case of these preparations, now you can see that the first step is functional diagnosis, second step will be the planning and mock-up, and the third step will be, as you see, the preparation to get the enamel into place. It also is very important. Here we go for the best lecture poll. So through the waiting for this voting, let me just say that it is quite important that the enamel is preserved, because if the enamel is not preserved, you will have you can have a loss of adhesion quality. The more enamel you preserve, the more adhesion quality you will have. So when I prep, I always prep through that. Okay. In fact, I think I had a prep video that didn't enter. Let me just check. Go back a little bit. Okay, no, I don't know where it is. Maybe it's misplaced. I'm sorry. Okay, so we're voting best lecture. Mauro Fardiani is winning the final lecture of the day. So let me just wait a little bit. Rui Pereira Costa is just giving a party here because he's in the second place. Is quite a super speaker, so it's not a very surprise for me. We had Jean-Pierre Attal from France, Ryan Tse from Hong Kong, Simon Sharp from England, Hélène Didier also from France, Paul Cabeza from Peru, Mirella Ferraro from Israel, Rui Pereira Costa from Portugal, and Mauro Fardiani from Italy. And the winner is Mauro Fardiani. Let's go back to the presentation and go back to the treatment phase. As you can see here, the treatment phase is in place. We have the preparation, and the fourth key will be materials. Materials are also very important as a key to your success. Not only the restorative materials that you choose, but the adhesive protocols that you apply. And also, of course, the moment of the cementation and the procedure that you apply. All these materials are very sensitive to humidity, so all the procedures that we perform in our clinic are performed under total isolation, as Dr. Stéphane Brouet talked very intensively during the first day. So regarding the restorative, you have also to take in consideration that either you have the enamel in place, or you need to prepare the dentin to receive that final restoration. So we start with the adhesives, and then we go for the restorative materials themselves. Okay, regarding the adhesives, after you prep, or imagine that you have an erosion case, as Dr. Francesca Valati told, and Dr. Stefan Kubi also told throughout this week. Here all this scientific knowledge was also very, very explored and very shared by Marco Gresnik yesterday, and Dr. Matthew Najat also yesterday, as well, of course, as every other oral rehabilitation speaker. But regarding the IDS, this was my investigation in 2011. Of course, the IDS was a protocol that was first talked about by Dr. Pascal Magne. It takes some other names, but IDS is immediate dentin sealing, meaning that after you prepare the dentin, if you have to prepare, if you go additive, you won't prepare, okay? But the dentin need to be taken care of. So the dentin needs to have a preparation, meaning that the exposed dentin need to have the adhesive placed over it, like a primary couch for the better adhesive properties. You have all through these lectures a lot of reasons to use IDS. I would say better adhesive maturity. You have also less sensitivity. You have the possibility to treat patients without giving anesthesia because the dentin is not exposed. You also have, of course, less contamination of that dentin throughout the moments through the preparation and waiting for the final restoration. So you have many reasons to use IDS as a normal protocol to prepare the dentin. Okay, if we go through the adhesives have been studied a lot. We have always a big number of articles and big number of reviews, but I would say that we have now three main groups. We have regarding the adhesive strategies. This is an article from Dr. Anas Zinando. We have this is like a review article. We have a group where you have the etch and rinse, also called total etch group. You have 3-step and 2-step. You have the etch and dry, also called self-etch and more known as self-etch, where you have 2-step and 1-step. And now you have the multi-mode, also known as universal adhesives, the etch and rinse, total etch, and self-etch, the total etch and selective enamel, etching, and also self-etch. Okay, so you have all this group, all this family together, a lot of adhesives. So if we go to the literature and if we explore in detail, what you have is Optibond FL is is a total etch 3-step adhesive that is the state of the art for the total etch. The self etch is the Clearfill SC with the 10 MDP molecule that brings up the chemical adhesion to the dentin, and the universal that has in fact been using the 10 MDP molecule together with the other procedures. Okay, so if you use adhesives into enamel, you have to use a total etch because the self etch does not have good adhesive resistance and results to the enamel. But if you use a restoration, and if you are willing to restore a surface where dentin is in place, either you go to a total etch like Optibond FL, or you need to do a selective etching with the Clearfill SE adhesive over the dentin and a bonding altogether over the dentin and the enamel. Okay, so regarding the materials, let me point out this great article from Pascal Magne and Dr. Panos Bazos from Greece, where we have an histoanatomic approach, a structural analysis of the teeth. And what we've encountered and we've understood with this article is the big dentin enamel complex that we have that functions and that brings up a functional shield to each tooth. So if we resonate a little bit, if we think a little bit, about this, what we can take from this article is, in fact, that if we have enamel, we will have same biomechanic of each tooth. So the tooth has not changed whatsoever mechanically. But if we have lost enamel, this functional shield is lost. So it means that if we have lost enamel and we have lost the functional shield, we need to have a new way of bringing up the functional shield and the resilience and the ability for that tooth to behave together with the adhesive rehabilitation in a way as if it was the intact tooth. That's why with the loss of the functional shield, the loss of the enamel, we will need to bring up some more resilient materials, some more plastic materials like reinforced polymers, such as Lava Ultimate or Enamic, or maybe some monolithic or some CAD-CAM material, composite materials. Okay, so this is the more or less what you need to think is the choice of materials is adapt with the structure that you have. Either you have the enamel or you don't have the enamel. If you have the enamel, the mechanic has not been changed, so you can use whatever rigidity you have or you want. You can use some feldspathic veneers, but I would say that if you have an endodontically treated tooth, what you'll have is the need to go for a more resilient rehabilitation and treat that tooth with, I would say, that plastic rehabilitation and plastic material. As you can see here, you have the work of my laboratory. I would like to say hi to Antonio, Pedro, and Eduardo. Without the laboratory, we are absolutely nothing. So one of the things I would like to say to you and to as an advice, always educate yourself with the laboratory. If you travel with the laboratory, go with them, and so you learn from their experience, from your experience. Without the laboratory, there is no dentistry whatsoever, no rehabilitation. And so there's nothing more important in my daily practice such as the lab technicians that follow my work, and I'm really, really thankful for all their effort to bring up those beautiful cases such as this one. I've just noticed that I don't have the image on the screen, so I was looking to the camera, and in fact, okay, I'm again on. Okay, so let me go back to the presentation. Let me just go for say hi. Now we go back to the presentation. As this is live, I need to push a little bit into the contact of me and you, and this is something that I always love when lecturing physically in a congress, in a room, in a university. So the connection between ourselves is really important. As you can see, an incredible work from Pedro Salvador, veneers, feldspathic veneers with 0.6 millimeters that were used and were seated on that case of that girl. Okay, so as you can see here, the big difference between the classic cementation and the adhesive cementation is that between the classic cementation, there's always a gap between the ceramic restoration, the tooth, and the cement. And the adhesive cementation, you have the ceramic restoration, the cement, the adhesive, and the tooth all together linked, fusioned as a whole, dynamic whole and mechanical whole. Okay, so regarding the adhesive cementation, don't forget that you have these two articles that are really important. If you want, I can email you all the articles of this presentation. I'm just showing some. Of course, there are many more that I use for this presentation itself. These are very important because they are like protocols for surface conditioning and for removal of clinical contaminants, and these are like standards that you should follow in your daily practice. Okay, so regarding the cementation, the adhesive cementation, you either can use some auto, dual, or photopolymerized resin cement, or you can use, as talked by Marco Gresny, you can use heated composites. So that, in fact, from the latest studies, we've seen that they improve a lot the final result, outcome, and success of your restoration. Okay, the isolation of the operatory field is also very important. You have many brands, many possibilities to isolate the operatory field. As you can see here, the lower jaw and the lower case, everything isolated with rubber dam, with Teflon, and you have here the preparation of this enamel for the seating of and the cementation of both the anterior veneers. The second case, that rehabilitation case, here you can have a detail of the preparation, everything in enamel except the incisal edge, all areas rounded, and of course some Teflon in the cervical margin to avoid any leakage of the cervical serum. So as you can see here, you have the surface that is polished and prepared to be etched and to finish the case. Sometimes when you don't use the clamps over each tooth for the cementation, you can also use, as also talked by Dr. Stéphane Brouet, you can also use the ligatures, as you see in this case. Okay, you see here the ligatures in place. So let's vote lecture 4. We have been talking about the 5 keys for the success of the treatment, the long-term success for your veneer treatment. Don't forget the diagnosis. Don't forget, of course, that you need to vote in www.menti.com, and the number is new number 590745. Who's the best speaker of day 4? Okay, so profiting from this little pause to get back, I love to repeat Dr. Louis Janet, Dr. Miguel Roche always tells me that repetition is exactly the way to learn, and learning is exactly that, is having all the lecture in place and then repeating. And this is also why we do this event free, and then we have an extra possibility for everyone to follow the lectures afterward if you are more keen to learn. Okay, in this case we have as the lectures of day 4, we have Miguel Roche, we have John Chu, Miguel Roche from Spain, John Chu from Taiwan, we have Simone Maffei from Italy, we have José Gabriel Colmenares from Venezuela, Jack Goldberg from Mexico, we have Andres Shen from Portugal, we have Nazari from Ukraine, and we have as well Mark Bowes from South Africa. I also profit from this moment to thank a lot, Mark. You've been great as a backup to solve that issue and that problem that we had with the speaker. And John Chu is getting the first position with Nazari. Just not easy. This voting is we have like a draw at day 4. We have John Chu is getting first place. Oh, this is curious today, huh? Now, sorry. We have we have to take a little bit more because we don't know who's winning. Oh, this is funny. Will it be Shu or will it be Nazari? Oh God, Nazari is coming first, but Shu is just it's like a day at the race. It's more or less like that, a day at the race. So just waiting a little bit, we go again through the 5 keys. The first key, functional diagnosis. Please do not forget, never go for and never start the treatment without the correct functional diagnosis. Second, planning and mock-up. The planning mock-up validates your treatment not only by the patient acceptance but also with the communication with the laboratory. Third, the preparation, keep enamel, round edges, smooth surface. 4, don't forget as well to have the materials into consideration. And the winner is Nazari. Nazari is the winner of this 4th day. So let me just continue with the lecture. Now we go to step 5 and we finish with step 5. And the 5th key is maintenance. Not only, let me just have the video and look at you because you are not seeing me. Okay. Please, the responsibility of this treatment is not only yours. It's also the responsibility of your patient. So when you have the patient acceptance on the second key factor to your success, in that moment you need to make your patient understand that the long term is also his or her responsibility. The patient will be using the rehabilitation all through the days and years for sure, and you will not be next to him, of course. Maybe you will meet him twice a year. So take time to get the maintenance and the maintenance protocol into place, educate your patient, educate what he needs to do. Patients with veneers and supragingival preparations, in my opinion, should avoid excessive brushing and excessive force in brushing. Sometimes electrical brushes are better because you can try to get an equilibrium, and by the pressure evaluator you can get your patient aware of the force he uses while brushing. But also at the same time, the electrical brushes can have some problems because they can go with some recession in the cervical area. Okay, so maintenance, and here we will show some cases and the follow-up of these cases for you to understand why we say that these 5 keys are really important. Okay, so here we have the first case, 1 year follow-up of this case. Okay, you have here the adaptation of the tissues to the veneers on the right side, on the left side. Okay, you have here also the canine guidance that allow us the disocclusion of the eccentric movements. Okay, and here the adaptation of these feldspathic veneers to the tooth structure, as you can see in this picture. So this is the first case, and I go the cases around. This is the least follow-up case that I presented throughout the lecture as the last one, and now I will present throughout the lecture the cases with more follow-up. Okay, the second case, the functional rehabilitation, upper and lower, they were rehabilitated with Emax lithium disilicate rehabilitations, overlays on the posterior, veneer lays, meaning veneer preparation and occlusal preparation, and upper veneers and lower veneers on this case. Of course, we had to use as well some extra volume on the palatal area of the upper canines and upper incisives to compensate the rise of vertical dimension. So here you can see the before and after of this case. The canines we have been giving some volume and of course new canine guidance and new canine ramp, okay, and here you have the rehabilitation and the details of these veneers, incisors, yes, sorry, I was saying incisives, sorry, they are incisives, yes, but they are incisors. So here you have the adaptation of the tissues. The tissues always give us a sense of health, of the treatment and stability. Here the anteriors, the the upper central incisors, and here the upper jaw, all the rehabilitation into place on tooth 16. This is a mirror view. You have an implant, so still waiting for the final restoration and closure of that screw access. Here the lower jaw rehabilitated, as you see, and so the final 1 year follow-up picture as well, as you can see here, before mock-up and final. Okay, before mock-up and final. And here the third case, here, sorry, it's case 2, but in fact it's the third case. This case with more years of follow-up. Little inflammation on the lower incisors, central incisors that we treated exactly in this visit, okay? But you can check the overlays on the 1/6 and 2/6, and you can also check all the veneer lays on the premolars and the veneers on the upper teeth and lower teeth, with some palatal veneers on the upper teeth for the adaptation to this rise of vertical dimension. Okay, so you can see here some details of this monolithic Emax rehabilitation, here before and after. Quite a special case, a brachyfacial patient with big muscle force, and so in this case you have a good stability with a 4 years follow-up, as you can see here. This is the third case. And we finish with 11 years follow-up of 4 veneers on the incisors, where we have as well to improve the gum, and we had to do a gingivectomy. In fact, in this case, it was a crown lengthening, also with a gingivectomy. Okay. And you can see in the upper picture you have not only a change on the color of the tooth 11 regarding and comparing with tooth 21, but as well you have still the tissues healing, and the papilla between 12 and 11 healing, and the papilla between 11 and 21 healing. But after 11 years, this is the stability that I have found, and so this is exactly what we need from a case like this one. Let me just finish with I'm just on time, finish with the 5 steps, 5 keys to success. Don't forget, first, functional diagnosis. Second, planning and mock-up. Third, preparation. Keep enamel, smooth surface and round edges. Round edges I will detail further, but normally it is for keeping and avoiding the excessive tension inside the cement and the ceramic. Okay, for the materials, not only the adhesives that you use, adapt to the structure that you are willing to adhere. Enamel, use a total etch, 3-step like Optibond FL. If you have dentin, you could use self etch like Clearfield SA and use a selective etching over enamel and perform an IVS after the preparation. And then don't forget, as well as a key factor, the materials that you choose should be adapted to the structure that you have. Either you have a functional shield, you have the enamel, or you don't have the functional shield, so you adapt the resilience of your materials to that. Okay. And finishing, don't forget maintenance. Maintenance is your responsibility, but as well the responsibility of your patient. Okay, so I will finish with the lecture, the voting of the best lecture of day 5. Best lecture of day 5 will be, let me just, and we also need to have the best lecture of day 6 today. So best lecture of day 5, we have first Alessandro Pozzi from Italy, second Univata from Japan, third we have Ramon Asensio from Spain, my dear friend from WIC. Then we have Christophe Hu, super lab technician from Paris. Then we have Matthew Najad from the United States. Then we have Dinos Konturas from Greece. Then we have Marco Gresnik from the Netherlands. And we finish with Paulo Cano as well. And now Marco Gresnik is leading. This is the best lecture of day 5 that we are voting. As we told you, don't forget that normally we will be sharing the best lectures throughout next week, and also tell you that if you want the articles, just email me to the regular email that I have been sending the information throughout this week. Okay, joãoborges@rpcendo.com. Email me for the articles, and I will get back to you all through these following 2 weeks. Okay, we've stopped day 5, and the winner is Marco Gresnik. Congratulations, Marco. It was a pleasure to have you and have all the speakers inside. Okay, and we get back to finish this lecture and to say that in the beginner's mind there are many possibilities, in that of the experts very few. And this is a very important quote from Suzuki, because in my opinion we are, in our profession, we are always beginners. We should always be beginners, because everything has evolved so fast and is evolving so fast that your knowledge is always very few from what you can in fact have. So the fact that you think as a beginner, it makes you hungry, as Steve Jobs says. Stay hungry, stay foolish. Always hungry for more knowledge. And it's a little bit through that exact thought that me and Rui discussed somehow in 2015. Maybe we should do something different, because there are so many people everywhere in the world that don't have possibility to reach that knowledge. Of course, you can reach through PubMed, you can reach through many other places, through books, etc. But books get just out of date. PubMed is always outside of the, like, 1 year, 2 years delayed from the investigation. So I would say that our main objective is to improve and to let world dentistry evolve as a whole. And the only way that we can do that is through a free congress that is that you have access from everywhere in the world, as such as this. Again, I must thank a lot, the speakers, because also without them this wouldn't be possible. And they resonate so much with us that they are really, really, really eager to share, and they just allowed their lecture to be shared, and to be shared so many participants throughout the week. We had from 1,200 participants, viewers, until almost 3,000 viewers per session. This is quite huge for a Congress. So let me thank you, and before I leave, let me just get the best speaker of day 6, because they also were part of this big moment. And day 6 we had José Nart from Spain, we had Victor Clavijo from Brazil, Russell Young, a repeating friend from Australia, Annabella Plana from Venezuela, Nguyen from the Netherlands, Nitzan Bishashu from Israel. This was quite an incredible week. Of course, we are as excited as tired, because we will get January to sleep for sure. We still have a lot of days of work ahead with getting all the premium membership material into place. So this voting is also quite interesting, with good equilibrium, with Nitzan Bishashu leading, but more or less getting Victor Clavijo also very close to Nitzan Bishashu. You can see that Russell Young is also very good and very pleased. People are pleased with this presentation as well. So let me just finish. Nitzan Bishashu won this contest of Speaker Day 6. Congratulations, Nitzan. We are very sorry that your lecture came a little bit late, but everything was in place to have a lot of viewers following your expertise, and have your years of experience into this great lecture. So day 1 we have Francesca Valati, day 2 we have I can't remember day 3 we have Mauro Fradiani, day 4 we have Nazari, day 5 we have Michael Gresnik, and day 6 we have Nitzan Bishashu. No, day 2 we have Christian Kochman, sorry. Okay, so let me just finish with my presentation, and I know, let me just finish with my presentation. Okay, and just tell you that I'm totally available for your questions. You can follow me through Facebook, either my personal page or my professional page, and also on Instagram, and also my website, as you can see here. And now let me share with everyone the super prize of the challenge, the 3 winners of the challenge. We will get into place a poll that is quite funny, where we will see, in fact, from the 6 participants, the 7 participants that scored the most, who in fact scored and wins the premium membership. We have Osama Al-Hanzi from Yemen that shared with us a super message, just talking from Yemen, from the middle of the war, and watching all the lectures. Sarah El Haddad from Libya. We have Nicole Echt from Israel. We have Denise Bob from Romania. We have Eitar Al-Dibs from Saudi Arabia. We have Dler Hama from Iraq, and Anna Cris from Portugal. And so let's see who's the winner. Who's the winner of this challenge? And the winner is Denise Bob. Denise Bob wins with 540 points the premium membership And the second place, Osama Al-Hanzi, wins the access to my online course, and Blair Hama wins the access to the Dr. Andreshen online course. Okay, congratulations to everyone. Thank you for participating. All the more than 1,500 participants that were with us in the challenge. Okay, so finishing, let me just say that this week is finished. Again, thank you so much to all the speakers. Thank you so much to the participants. We have been having a super intensive week from 8 o'clock in the morning to 11 o'clock in the evening, and now the free access of these lectures allowed more than 12,000 people to view and follow the best in aesthetic dentistry worldwide. Don't forget that if you have if you want to review a lecture, or if you have you are eager to learn a little bit more or to review any of the lectures, you still have until today, you still have like 2 hours and a half to profit from the promotional price of the premium membership, and get the premium membership to access for 1 year all the lectures. You also access, of course, the online course on minimally invasive dentistry given by me. You also get into place the access to the online course of Dr. Andreshen, and you also get the 3 live Q&As that we will have after this online courses. Don't forget this this premium membership is also is also a way to help this project to exist and to keep it going. This is an independent project because we really want to decide and to be free to decide which speakers to invite, and also all the technical details are into place because of our effort. This is also a mission that fortunately we have accomplished. Not flawless, unfortunately, but we tried the best to give you the best experience possible. The premium membership, you also have the certificate of attendance, and you will have the possibility of checking and reviewing all the lectures throughout 1 year to have, in fact, the possibility to get back to the views and to the speakers that you have missed. Okay, don't forget as well that we are here also for sharing. So if you by any chance feel that the premium membership is not very interesting for you, you have 15 days to get your money back without any questions, because we really want to deliver an experience and to deliver something that is good and profitable for everyone. Okay, as this is an independent project, I would like to thank as well all the team behind me. We are not that many. It's me, Rui, our families, also Dr. Barbara Pereira Costa, Dr. Joana Rodrigues also helping, and all the teams at the office that have the patience to collaborate with our crazy moments of stress and trying to deliver the best experience possible. Let me just call Rui here just to say bye, because it will be really important for everyone to say goodbye to an extraordinary colleague and friend. We have tried our best, we have accomplished. I don't know if you want to say something.
No, just thank you very much for all your participation. It was really overwhelming. It was a very intense week for all of us. I know that it was also a very intense week for many of you that followed us very closely, so we kept chatting with you guys in Messenger, especially in Messenger. We noticed that we had a huge amount of participants talking with us. So thank you very much for that. I hope the experience that you got out of this Congress was the best one possible. As Ron said before, we are sorry for anything that happened, just that went a little bit away from our hands. We tried to do our best, and we always tried to make up for any mistake that happened here and there. So thank you very much, and I'm sure that we'll be back.
Yes.
In a few times.
We have some crazy ideas and some projects, so
sure.
we'll keep you updated with
our craziness doesn't stop here.
No, of course not. Okay, bye the
Bye-bye.
world,
Thank
from
you, guys.
Lisbon to the world. Thank
Bye-bye.
you so much. Bye.
See you next time.